Hello, I'm Cooper Scurry. I'm a facial plastic surgeon in Winston-Salem, North Carolina. What we're going to do here today is start to record some of my cosmetic consultations onto this YouTube channel that we've got set up. So what we're going to start with today is a video of me talking through a facelift consultation, standard facelift consultations. Patients present to us all the time with a number of chief complaints, and one of the things that I always tell people is I like in any consultation for a patient to tell me what it is that's bothering them, and then I'll try to prescribe what I think will be helpful for that symptom, we could call it, just like regular doctor visits. You give me something that's bugging you, and then we'll talk about what might be helpful. As opposed to, a patient comes in and says, I need a facelift, or I need a laser, or I need some Botox. And I prefer a patient to tell me what's bugging them, because potentially sometimes patients might think that a certain treatment will help what's bugging them, and it might not be the right prescription. A great example is when a patient says, I'm really bothered by these deep wrinkles or fine lines, and I'd like to have a facelift. Well, one of the things you learn when you start thinking about facelifting procedures and cosmetic facial surgery is that those lifting procedures, they don't actually smooth wrinkles. So for fine lines, deep wrinkles, you would need some form of resurfacing procedure. And this is the type of information that comes up during these types of cosmetic consultations. Let's talk a little bit about what a facelift consult sounds like when you come see me. So when a patient comes and says that I'm bothered by this sagging along the jawline or laxity in the neck, I don't like the turkey neck or heaviness, pre-jowl area, what I start to describe is the ways by which we can improve that. And so the first thing I start to demonstrate is the areas that we begin a surgical procedure. And so what I mean by that is a facelift and neck lift in my hands begins with a little incision under the chin. And that incision is in a fine little crease under there that hides real well and then heals real well. And that gives me access to begin operating, to begin loosening up and tightening this platysma muscle. So the platysma muscle is a thin sheet of muscle tissue in the neck. It actually does extend up into the face. It comes along over the mandible, the jawbone, and it's continuous with a muscle system in the face that we call the SMAS. SMAS is an acronym. It stands for Superficial Musculo-Aponeurotic System, and it's a muscle system in the face. Again, you just heard me say it's continuous with the platysma in the neck. So we begin a facelift with an incision underneath the chin. That gives me access to this platysma muscle. We dissect underneath the platysma muscle as well. What we do in facelifting these days is we really try to minimize the undermining of the skin, and I'll talk about that a little bit more in a few minutes. But I like to tack this platysma muscle here in the midline. We like to secure it to some of the deeper tissues or secure it even to the other side of the platysma. And that kind of anchors it there in the midline, such that now when we go back and we work on the platysma in the back of the neck and we move that platysma in a different direction, it'll be anchored in the midline, and then we'll begin to lift it posteriorly, we would say. So the next step in a facelift or facelift neck lift, and in just a second I'll explain kind of how facelift and neck lift go together. The next step is an incision that begins, I say, it starts even with the corner of the eye at about the sideburn. And it then follows a patient's hairline towards the top of the ear, the root of the ear, and then it comes down in front of the ear, that is the incision. Sometimes we can come right in front of the cartilage of the ear that's called the tragus. Sometimes we can go behind the tragal cartilage to hide that incision. It just depends upon a patient's individual anatomy. When we get down here in front of the bottom of the ear or the ear lobule, the incision then curves, it comes back behind the ear, and then I like to follow the hairline back behind the ear. These incisions that are going along the hairline or within the hairline or right at the hairline, what we do is strategically we bevel the incision. Somebody asked me recently, what does that mean? Well, usually we make a perfectly perpendicular incision in skin, and in the hair areas, if we bevel that incision, the scar that then subsequently heals down the road, it enables hair follicles, hairs, to grow through the scar and help to camouflage that scar. So that's another strategy that we use to camouflage facelift scars and help them to be very hard to find when it's all said and done. All facelift, neck lift incisions, as I just said, they should be hard to find. You should be able to go to your hairdresser down the road and maybe they marvel at it. They're like, wow, I can barely find your incision. Of course, there's a healing process, but those incisions should be well camouflaged. Okay, so after the incision, during a facelift or neck lift operation, that incision and that lifting up of minimal skin is just meant to give us access now to the deeper tissues. In my practice these days, I truly do a deep plane face and neck lift, and I'll tell you what that means. That means that there's not going to be tension on the skin. We're going to have made the incision, we're going to undermine some of the skin to gain access, but then we're going to focus the attention of our lifting. We're going to say the heavy lifting of the operation is going to be on a deeper plane in the face. So I go to about the cheekbone and I come to about the corner of the jawbone or the angle of the mandible, and I draw a line between the cheekbone and the angle of the mandible. But then I modify that incision, and this was popularized by Ben Talley in Beverly Hills. He calls it a sailboat modification, where the incision, it comes back towards the ear and then towards the angle of the mandible. It just gives us surgeons easier access to that deep plane. Then what we do is we dissect under the deep plane. When we dissect under the deep plane, what we're doing is we're releasing ligaments. There's ligaments that hold this SMAS in place, and when we release those ligaments, then that SMAS and platysma flap can be mobilized in a very specific, accurate, anatomic, geometric vector chosen such that that SMAS flap goes in an appropriate, natural direction. And that's what gives a good facelift result in terms of looking natural, looking like you did 10 to 15 years ago. When you have a facelift or a neck lift, you should look like yourself. You should be able to take a picture of yourself out from 10 to 15 years ago, and that's what you look like. There shouldn't be telltale signs. Those should be goals of your surgeon, is for when you meet somebody new, they don't know that you've had a facelift. Now, your nearest friends and family that you see on an everyday basis, they should be noticing a difference. You should be noticing a big difference. But sometimes observers might not even be able to put their finger on it. They may say, if they haven't seen you for a while, they may say, wow, you look great. What has happened? Did you lose some weight, or did you just get back from vacation? And a facelift or a neck lift, well, that can be your secret. You can share with people, or you can just say thank you. So, okay, so we've talked a little bit about technique now. We've talked about incisions. There are deep stitches that are placed, and those are dissolvable stitches that don't ever have to come out. And that's what does, like I said earlier, the heavy lifting and relocates that deep plane facelift flap. After that flap is laid down and secured, then we lay the skin back down, and we do a lot of tailoring and meticulously putting in little bitty stitches in the hair-bearing areas right here in the sideburn and behind the ear. I oftentimes will use some little metal clips to help support things as I go along. And then in between metal clips, I'll put little bitty, like I said, meticulous stitches to make those skin edges just perfectly approximated. So there should be no tension on the skin. Those metal clips that go in the hair area, I use them because they go in more easily and they come out more easily relative to hair. Those clips and stitches, they all stay in place for about 1 week's time. So those come out at your 1 week follow-up visit. At the end of that operation, I will put a big, heavy, bulky dressing in place. The dressing that I use, for the most part, enables me to not have to use drains and tubes like some surgeons use. This is a dressing that I took from my fellowship director, Dr. Galen McCullough in Alabama, one of the real forefathers of facial plastic surgery. And so all of my facelift patients get that dressing these days. There's one other detail that I should include, and that is this incision that I said is even with the corner of the eye, stops in the sideburn here. Oftentimes, because of the power of the deep plane facelift and how the skin moves back with the deep plane, there'll be some bunching of skin right here. And one of the strategies that I employ to smooth that out is to make a little incision in the hair And sometimes that will be part of the operation. Sometimes a patient will be indicated for brow lifting as well. If a patient doesn't need a brow lift, well, then I do less surgery, but I still oftentimes make that little incision hidden back in the hair to smooth out that extra skin. So an additional incision, but hidden in the hair. Okay, so that's the technique, that's the operation. Let's move on to the process a little bit. And I've told you a little bit about getting the dressing on. You come back the very next day in order to have that dressing removed. We do that here in the office. That's what we call post-op day 1. And let me tell you a little bit about that recovery process. I like to divide it up into 3 phases. So phase 1 of the recovery process is that first 48 hours. In the first 48 hours, I tell people that I've done a lot of things in the operating room to minimize bruising and swelling. And now I ask you to do a couple real easy things. And here they are. Number 1 is we found that arnica helps. So we kind of put that into your quote, into the process. We highly encourage you to use some oral arnica tablets, like a vitamin or supplement, the week before surgery. And then there's some arnica gel that you can use to help with bruising and swelling afterwards. So that's thing 1. But the other 3 easy things that patients can do immediately after their surgery to help minimize bruising and swelling, they are easy. 1 is do nothing. So facial plastic surgery does not have a rehab program afterwards. It's not like knee surgery where you're getting up and moving around right away in the recovery room. We want you to just relax. We just want you to go home. The next thing I like you to do is be in a recliner. We think a recliner is helpful for 2 reasons. 1, of course, your head is elevated, so bruising and swelling gets the benefit of gravity and it goes down more precipitously if your head is elevated. The other thing is it helps you to just lay flat on your back in that recliner, so you're not going to be rolling over on your side and putting tension on some of those deep stitches. The other thing that can be helpful is just cool compresses. So we believe still that cool compresses are helpful for minimizing bruising and swelling after these surgeries. So that's the first 48 hours. After 48 hours, cool compresses don't help anymore. Another thing I always like to say to patients is I prefer cool compresses to be in the form of just getting a bowl of ice water and just soaking a washcloth or some gauze, wringing it out and laying it along the areas of the surgery. I don't like you to get something out of the freezer, something commercially available. It might be too cold. Absolutely, you will have some numbness in the cheek skin after a face and neck lift. And so we don't want you to use something that could be too cold in an area that you're having numbness. So again, next phase of that recovery period is after 48 hours are up, and even during the first 48 hours, you can be up and about in the house. It's nice to have somebody that can help you. It's nice to have somebody that can just bring you water or some soup or things like that. But after that first 48 hours, you can be up and about in the house a little bit more. You shouldn't feel so bad. There are 2 main goals of having face and neck lifting with me. 1, of course, is a great outcome. But the other thing is we want it to be a reasonable experience. And so we do lots of things to make it that way. Most of our patients don't use very much, if any, pain medicine, true pain medicine at all. I prescribe tramadol these days, a minimal number of pills or tablets, but I find that most of my patients are getting by with Tylenol or ibuprofen or naproxen. If you use a pain pill like tramadol, it's usually only that first 36 hours when the big dressing is in place. And then after that, it's those Tylenol, ibuprofen, or combination of those that seem to be plenty for patients. I don't like, during that first week, I don't like patients trying to do chores around the house or running errands around town. I just want you hanging tight and, like we already said, just relaxing. Lots of patients that have a facelift are ambitious, type A kind of people. And one of the hardest parts for them is just relaxing and kind of doing nothing for that first week or so. Okay, I see you at post-op day 1. I oftentimes want to see you sometime in between before that first 1-week visit. And so maybe I'll see you back post-op day 2. Maybe we'll give you a couple days and I'll see you on a Friday before the weekend starts. If you have your operation on a Thursday or a Friday, I'm going to be willing and able and available to see you on Saturday or Sunday. I'm going to see you when you need to see me, okay? So then at the 1-week mark, you come back in and you get those sutures removed, you get some of those little clips removed, and that's not really that uncomfortable. We will take those clips and stitches out one at a time and we'll say, okay, this is what it's like. And most people will say, okay, this is going to be okay. After 1 week's time, I usually leave a couple little small blue 5-0 sutures right at the earlobes just to protect those earlobes for when you might take your shirt off or something like that in the second week. At 1 week's time, you are still having some bruising and swelling. In the first 48 hours, you'll notice that bruising and swelling will increase for the first 48 hours. So say you have your surgery on a Monday, you come to my office on a Tuesday to get the dressing off, and then on Wednesday, you will be more swollen on Wednesday than Tuesday. Now, after that first 48 hours, the bruising and swelling, it just kind of sits still for a couple days, and about day 4 or 5, the bruising and swelling starts to resolve. So then when you come back at day 6 or 7 to get some stitches out, you still got some bruising and swelling quite a bit on board. But the big news, the next big step is between 1 week and 2 weeks, at the 2-week mark, you have lost 80% of the bruising and swelling from the surgery. This is true of any surgery or injury. 80% of swelling resolved at 2 weeks' time. So I like to say that's the downtime. 2 weeks is the downtime because of the bruising and swelling. Also, 2 weeks is kind of the way I like to limit people's activity. So we say no heavy lifting, strenuous activity, getting your heart rate or blood pressure up for those first 2 weeks. At the 2-week mark, I start to cut you loose a little bit. It's okay with me if you start to resume some activity, get out and move around a little bit. There are things that I still want you to be cautious of. We often say, don't fight the tightness. So when you have this lift and you have this tightness here in the neck and along the jawline, that's good news. We want that to last as long as possible. And so we say, don't fight the tightness. A great example I always like to use is just, be cautious with things like yoga. So, yoga's famous for stretching and certain poses, and I don't want you to stretch some of this work that we've done. So it'll be okay to start resuming doing some light cardio work or going for walks or going for jogs, going back to the gym, but you just want to use common sense and be careful along the way. Okay, well, this is getting towards the end of what a normal consult sounds like. One other thing that I do like to remind folks, in cosmetic surgery, the most important thing in all of surgery, but in cosmetic surgery especially, safety first. So when you meet me, when you come to our office or we do a video visit, we will take a thorough medical history, of course. But I will always, even after you've put everything into our iPad or into our computer system, I will sit down with you, whether it's on the telehealth visit, the video visit, FaceTime or Zoom, or whether it's live and in person, and I will look you in the eye and I will say, do you have any major medical problems? Do you have heart disease, lung disease, kidney, liver, diabetes, anxiety, depression? And so the reason for that is some of these surgeries last a while. If you've ever had a heart attack, or you have lung disease, or you have sleep apnea, it doesn't necessarily absolutely eliminate you from having that surgery. A lot of heart patients, when they've had catheterizations and their vessels are now wide open, they're way healthier than, of course, before their heart treatments. But we, of course, need to know that, and we certainly are always going to be very cautious in screening patients for having excellent health history if they're going to undergo one of these surgeries. So the way we attain that kind of screening process is we have a form, what we call a letter of medical clearance, that we have either your primary care doctor or a cardiologist or your specialist A-OK. We have psychiatrists sometimes sign those letters if there's mental health history. We also check an EKG on anybody over 45 years old, and we check some lab work. We're looking for hemoglobin counts, we're looking for platelet counts, we're looking for coag counts, and we're looking for normal electrolytes as well. So that, of course, is a very important part of the preoperative screening process. Once we have that information back into the office, and again, we like that to be in place. Once we have a surgery date picked out, we like all that data and information to consider you cleared for surgery. We like for that to be in place about 2 to 3 weeks ahead of time from your surgery date, so we have time to review it, and then if there's anything that we're concerned about at all, we can sort that out and call and talk about that. Okay, so that is the preoperative clearance process. That is how we do the operation. That is the downtime in the recovery and the process perioperatively around the time of the surgery and postoperatively. Once again, I told you that I would see a patient, of course, back on post-op day 1, sometimes day 2 or 3 or 4 or 5, and then, of course, at 1 week and 2 weeks, at 1 month and 2 months. We told you that 80% of bruising and swelling resolves at the 2-week mark. We say that 90% of bruising and swelling is resolved at the 2-month mark. We like to say that if you have a big event coming up, maybe it's a wedding or a reunion or some family activity, giving yourself a good 2 full months is a good time frame for those events. I told you you'd be back to doing things and active and going to the grocery store, etc., at the 2-week time for sure. And some patients get back to work sooner. Some patients like to go back to, are totally comfortable going out to the grocery store at 1 week's time. But in terms of covering up some bruising and swelling, 80% of bruising and swelling resolving, 2 weeks is that kind of magic time for us. I think that's, again, wrapping up the consult. If you were sitting here with me in our office today, what we would do next is I would get up and leave the room, and I'd go to my computer and kind of put together the quote. A quote for any cosmetic surgery or any surgery in general is always going to include the fee for the surgery, the fee for the anesthesia, and the fee for the operating room. Some people call it the facility fee. So there's always those 3 numbers. If you and I have talked about other adjunctive procedures to go along with your facelift, maybe like a brow lift we mentioned, or an upper eyelid surgery, or some laser resurfacing around the mouth or the lower eyelids at the same time as your facelifting, or fat grafting or fat transfer, that's another great adjunct to go along with facelifting. Those will all be itemized in the quote. And all of these surgeries, I know how long it kind of takes me to do these, so we will itemize the procedure, and then I'll kind of add up the amount of time that I know that it'll take, and that's what always determines the facility fee and the anesthesia fee. I operate at a number of places. I operate at a surgery center right here in town that's fully accredited by AAAHC. I operate right across the street at one of Novant's hospitals called Medical Park Hospital. Both of those places I've been operating for a long, long time now and are great places to have surgery. The other thing that we would be doing at this moment in the consult, we'd take some pictures of you, and you'd have a chance to meet with our patient care coordinator, and that person would go over with you the quote and some of those preoperative requirements, giving you paperwork and a folder with some articles that I've written. Those articles can be found on our website. That's getting close. So we'd love for you to reach out to us. If you've sat here and watched this YouTube consult video, know that you can call, and if you don't live real local, we can schedule a telehealth or a video visit. We have folks doing that and then traveling to Winston-Salem to have these procedures these days. So we hope that you'll give us a call and reach out, and we hope to get a chance to meet you sometime. Thanks so much.